Welcome back. You're still watching Nigeria the road to 2019. I am Christian Nogodor. Thanks for staying with us. Now, earlier I discussed with Dr. Bashir Jibril, who is the President, American-Nigerian International Healthcare Consultant based in Daytona Beach, to analyze the policy document of both the All Progressives Congress and the People's Democratic Party, particularly looking at what both parties have proposed for the health sector. Wondering, why do we have a medical personnel here? He's not a politician, but you tell us, I mean, that the health of a nation's leader is symptomatic with the health of the entire nation. Am I right or wrong?
You're right. It is absolutely correct, Chris. I'm not a politician, but my field of specialization is geriatric and gerontologist. And that's what I've been doing in the United States of America, especially in Volusia County, that is Daytona Beach, Florida.
Yeah.
And it happens to be the first black man ever had actually introduced geriatric medicine or assisted living facility in Daytona Beach, Florida. That is 1993. And I was given an award for that purposes by the senators, by one of the senators, which actually I took care of his mother and father. And that is actually increases their life expectancy. The doctors had given that very individual 6 months to live, but he stayed with me for 7 years before he died. And that is the main reason I was given Congregational Award of the United States of America.
Beautiful, Dr. Hassan Bashir. Where you practice in the last 4 decades now in the US, somebody seeking political office must be hale and hearty. Why is this very important, and why do you think it's not, you know, sine qua non in this part of the world? Yeah.
It is quite true, because the question in here is that the elderly people require professional care. That is the very, very important aspect for the white, or especially in the United States. So here in Africa, and particularly here in Nigeria, now the care is rendered by the family members. But at the same time, the family members are not professional. And therefore, we want the elderly people life expectancy to increase as much as possible, and this to be given, you know, by the professional cares.
Look at it from political perspective, you know.
Well, the political role and expectation, it has not been started for elderly care facility. But I think now, about 3-4 weeks ago, I think I was consulted to attend a meeting, and that is, you know, from the political spectrum, and that there is no any gerontologist in the northern part of the country. So they brought one gerontologist, you know, from the west and eastern part of the country, and then it happens to be one of the northerner who actually specializes in geriatric and gerontologists. I think this is a breakthrough, you know, by the present political spectrum, by trying, you know, to introduce a geriatric and geriatric system in the healthcare system here in Nigeria. That will increase the life expectancy of our mothers, fathers, brothers, and sisters. I think I'm very, very helpful, you know, with this aspect, and I will play a significant role, which I did in the United States of America. I think it is very, very happy, you know, to do it in my motherland, which is
Nigeria, not fatherland.
Nigeria is a motherland. Could be fatherland, yeah. Both father and motherland.
Okay, okay. But now, let's get down more to the nitty-gritty of the two political parties and their health care, you know, programs, what they've said they want to do. Take, for example, if you look closely at the All Progressives Congress, the next level agenda for the health care, it has promised insurance for all using co-payments. It says co-payments to share the cost between the individuals, between government, and between the private sector. while the poorest 40% in the society are going to be exempted from such co-payments. Are this really the kind of, improvement our health system needs at this time? And in other words, is that enough to revive Nigeria's healthcare system?
To say something is quite different from to do something. So at this very level, I would like the healthcare system here in Nigeria to improve. I cannot say to improve up to the standard of the United States 100%, but I would like it at least 80 to 90% of the Nigerian healthcare system, especially health insurance, to improve up to the standard of that of the United States. Now, United States healthcare system is very, very important. You've heard about Obamacare.
That Trump is trying to unbundle now.
But something like this, Trump will fail. It will fail. Because healthcare system, especially health insurance, is very significant. It's very, very, any political party to succeed in the United States, they have to have the healthcare insurance.
I want you to use this to signpost your argument. What I've talked about, the All Progressives Congress co-payment health insurance system. Co-payment, that is the individual contributor, government will contribute, the private sector will contribute maybe 60%.
Yes.
Then 40% of the poorest, they are going to be exempted, that is they won't pay any farthing.
That should be extremely very good. It is significant. I do not want to say 40%. I would like, if possible, 80 to 90% of the poorest has to be covered by health insurance, as it is practicable in the United States. So why not here? Definitely that will improve the people, because there are some people actually right there, and they pay health insurance, they are not able to pay healthcare insurance. The drugs, very, very expensive. The surgical intervention, very, very expensive. The admission, very, very expensive. Now the healthcare sector up there in the United States is covered. 90% of individuals who could not be able to take care of themselves is covered by healthcare insurance. Co-payment is very, very important. Co-payment is very, very important. Neither payment is also very, very important. Those who can afford, they could be able to pay health insurance as much as possible. That is, so at this very level now, I think if they will be able to implement the healthcare system here in Nigeria, I think that is a breakthrough in the healthcare system here in Nigeria. So healthcare is very, very important, because I've been seeing that some people in here could not afford to pay their medications. And they go to the hospital. There is no even food to eat. They go to the hospitals. Surgical intervention, they could not afford to pay for it. And they themselves, they are having very difficulty to get their basic human need. 3 square meals are having it very, very difficult. Medication, even if there is a medication, that medication may be expired. That medication may be, there is no any diagnosis for them. So at this very level, I would like the present administration, the APC or PDP, I would like to have very, very significant, important aspect to improve the healthcare system by providing health insurance to all the masses, maybe 90% of those who could not pay. But those who could be able to pay, let them pay. But without paying it is not good. And that would decreases the individual going abroad for the healthcare system. That is have a significant impact. Me, myself, I'm coming in here. Now, if there is no any good medical setup, I will find it very, very difficult. All my medication that I come, I will have to bring it from the United States, which is not good. Now, for example, dental. Now, people are less educated to provide their dental care. Now, if you do not have a good dental care, that eventually, will affect the heart, and the healthcare system, will improve, will decreases to the to the zero balances, especially the ophthalmic, the eye. There is no any ophthalmologist that will be able to significantly take care of the eye sector. And this is actually has a significant impact on the elderly people. Now, when the elderly people could not be able to see and fall down and have a hip fracture, what will happen? The healthcare system of that very individual, it decreases. And it goes along with food, well-balanced diet. No any hospital in the United States that they don't take care of their feeding, of their accommodation. You see, at this very level, we would like healthcare system in this country to be standardized. And I believe, I strongly believe, the present administration, I think if they get a lot of backup, I think we'll be able to improve the healthcare standard. I believe so.
Okay, Dr. Bashir, let me reel out what the presidential candidate of the People's Democratic Party articles policy document on the health sector is saying. For example, what would be your take on his, intending policies for all these important sector, following the shortages of medical personnel, whether doctors, whether nurses and the rest, and even the fact that hospitals have been reduced to consulting clinics. The article is saying in his policy statement here that is going to ensure a comprehensive reform of the Federal Ministry of Health and its agencies, accelerate Nigeria's transition towards achieving universal access to affordable and quality healthcare services for all by 2030, expand access to basic primary healthcare. And a lot of experts say that's the bane of the Nigerian health system. The primary healthcare system in the rural area, they are often very absent, you understand, and you're talking of tertiary or secondary healthcare system, which is not affordable to a lot of Nigerians. It says again that it's going to unlock market potential of the health sector by engaging the private sector. So what are your takes when you look at the PDP's presidential candidate's own policy document on how to revamp the health sector? What
the corruption, because the question in here is that the key issue in this aspect, regardless of any political affiliation, is corruption. If the corruption does not curtail, I think all the sector, all the governmental sector, private sector will fail, especially healthcare sector. If the healthcare sector, if the corruption is penetrated into the healthcare system, that is dead dying to the community. And at this very level, you have to evaluate by yourself. The community, the common people have to evaluate themselves. Between Buhari, that is the present president, and Atiku, who among them will be able to curtail corruption? If the corruption has not been eliminated and corrected, I think matter of improve the healthcare system is just nothing but is not significant, will never happen. Is a zero happen, neither happen, it will not happen. Unless this corruption has penetrated everywhere, including the healthcare sector.
Even in America, there's corruption.
Well, even in America, it's corruption, but there is a limitation corruption in the United States. But in here, one individual embezzle billions. So I consider this is delusion of grandiosity, not delusion of persecution. There are only human beings perform two delusions. Delusion of grandiosity and delusion of persecutions.
Okay, let's eliminate corruption here now, but unlock this policy document as presented by the PDP candidate. You've underscored that of the APC, the next level. Let's hear you see.
But the question in here is that if, say, is quite different from doing it, I may say anything, but can I afford not to do it? Can I be able not to do it? But this is a political gimmick. I consider it political gimmick.
But by both parties?
Well, the both parties now, at this party that we are in now, they are trying to curtail corruption and to improve the healthcare system. Because I attended a meeting that they are going to establish geriatric and geriatric medicine throughout the country in 6 political parties. or political
zones,
spectrum,
rather.
zones,
Yeah.
zones. I'm saying zones. At this very level now, if they have implemented this their program to mention about
Don't you think that is politically motivated?
anything is politically motivated, everything. Because politicians can say anything, but to do it is a different thing altogether. But at this very spectrum, I think if they are coming out to be a patriotic, we're talking about patriotic and patriotism. Patriotic should be better than anything else. Now, if someone say, instead of actually are not taking care of medical practitioners, nurses, doctors, pharmacists, and so on and so forth, and there is no any drugs. Now, these healthcare providers will go away and leave this country. Because the question in here is that, if they find very difficult, find it very difficult to feed themselves, to maintain themselves, they will go to a greener factor.
Let me tell you one of the key issues in that policy document by the PDP presidential candidate. It says it will encourage medium and large-scale pharmaceutical industries for the local production of essential drugs and expand healthcare professionals to the front line and attract Nigerian doctors in the diaspora to reverse brain drain. So people like you are going to be attracted back to the Nigerian nation to help revamp the health sector.
Because I felt guilty to myself, particularly to myself, I felt guilty for what actually my state, which is Borno State, did to me. Help me to go to University of Nigeria in Suka. Help me to go to the United States and do a bachelor's degree in nursing, do master's degree in microbiology, do PhD in health administration, come back, become a geriatric and gerontologist, all with the help, with the assistance in service training in Borno State. I felt guilty that I have to do something for this country in here. No matter what, I have to do it. Because if I sleep, I couldn't sleep. If I lie down, I couldn't even lie down in here. So, but there are a lot of obstacles on me, a lot of obstacles compared to the United States. You see, when I established the healthcare sector, in the state of Florida, they have given me award, congregational award, and they become me a citizen. Be a citizen, stay in here, we could do anything, for you. I was able to open an assisted living facility in the state of Florida. But will I be welcome here in this country? The question is very, very difficult, because the culture, the system, everything is polluted, manipulated by few individuals.
If you run away from it, who is going to help in redressing these issues?
But the system will cause me not to run away from it. But I resisted.
So are you coming back home?
I will definitely come back in here and make a difference in the healthcare spectrum here in this country, if I like it or I don't like it. Otherwise, if I die, I may not feel comfortable in my soul. So definitely, I will do everything. Now, I've started it. I've already started it. Getting in touch with the Minister of Health, and I'm going to see him very, very soon. And I told him that there is a geriatric and gerontologist in here, in the northern part of the country. They said there is no any geriatric and gerontology in the northern part of the country. I said, here is it, here am I. And this is what I did in the United States, and this is exactly what I'm going to do in this country before I die.
And okay, you've been away for quite a while now, but I just want you to quickly assess the political terrain. You want to compare it during your own times of the likes of Ahmadu Bello, of the likes of Awolowo, Zik, and the rest, even Kashim Ibrahim, and other greats like that.
I think those days, although I was very, very small, although I never ever cast my vote in Nigeria, but I casted my vote in the United States to vote for Barack Obama. Those days politicians are quite different from these days politicians, because those days politicians, I was just looking at them, glimpse at them. I've never seen any one of them physically. I saw Awolowo I saw him. He visited, my brother, which is General M. Shua, when he was admitted, in the hospital in Lagos. I saw him, but Ahmed Bello, I didn't see him personally. Zik, I did not see him personally, so I didn't see them, but they are corruption-free or less corruption those days compared to now. It's very pathetic, very unfortunate. And those politicians were very, very patriotic. So compared to them in here. So at this very level, if we learn from our mistake, then we'll be able to correct those mistakes. Everybody is really, not about mistake. We are all human beings. We will have cross all of this. But the question in here is that we have to correct our mistake and make this, our country, move forward. We do not have any other country than this country. We don't have any other place than in here. This is a resourceful country. And I think with this very level in here, if you all stand up and go against corruption, and then be patriotic and patriotism, forget about self-centered, because everybody in here is a self-centered, egocentric individual. Immediately you get a position like this in here, you change everything. The way of move, it changes. The way of talking, it changes. The way how your accommodation, it changes. So this is the problem that we have in here, which is quite different from that of the United States.
So that's why the campaign for the young ones to come in now.
I love it. If they will let them come in, I think I love it. And if they will give a chance to the women, I also love it. Women are made to be less corruptible. Women are made to be not delusional of grandiose. They are not grandiose. They are delusion of persecutions. So you have to fear with delusion of grandiose. Most of our men in here are delusionals of grandiosities. It is me and nobody else. It is I and nobody else. I'm the only Superman in this world and nobody else. Immediately they get the position, they change everything. Everything has changed. So that is what is killing this country, and that is what actually is bringing us backward.
Well, I can't thank you enough. For the first time, we're having a health professional on Nigeria 2019, which basically is a political platform for Nigeria's general elections in 2019. Thank you so very much, Dr. Hassan Bashir Jibril, who is the President, American-Nigerian International Healthcare Consultant based in Daytona, Florida, the United States. He's also a senior consultant gerontologist specializing in geriatric medicine. Very warm appreciation.
Chris,
and I thank you very much.
Thank you, my brother.
Cheers.
Thank you.
Thank you. Well, that's all for this edition of Nigeria, the Road to 2019. Join us again for a fresh edition tomorrow. From me and the entire team here in Abuja, goodbye and thanks for watching.